Assalamualaikum and hi to everyone and Madam SAIYIDAH. My name is NURIN IRDINA binti Muhammad Safwan from Group 4. Today, me and my groupmate will be discussing about our topic for today, which is called motor neuron disease. We will be describing and presenting the effect, symptom, causes, and also why it is related to the death of Malaysian professional football player named Mokhtar Dahari.
Let's talk about motor neuron. What is motor neuron? Motor neurons are cells in the brain and spinal cord that allow us to move, speak, swallow, and breathe by sending commands from the brain to the muscles that carry out these functions. Their nerve fibers are the longest in the body. A single axon can stretch from the base of the spinal cord all the way to the toes. On this slide, I will tell about the facts of motor neuron disease. Based on the research, MND is given to a group-related disease affecting the motor neurons in the brain and spinal cord. Furthermore, it is progressive fatal disease that can affect any adult at any time. And the last one, life expectancy for most people with MND is 2 to 5 years. Around half will die within 14 months of diagnosis. And you know what? Professor Stephen Hawking, who has survived with MND for more than 35 years, he has a very rare, slowly progressing form of the disease. You know that motor neurons are divided into two types, which is upper motor neurons and lower motor neurons. They are forming various tightly controlled, complex circuits throughout the body. This controls both voluntary and involuntary movements through the innervation of affected muscles and glands. The upper and lower motor neurons form a two-neuron circuit. First, the upper motor neurons originate in the cerebral cortex and travel down to the brainstem or spinal cord. Second, the lower motor neurons begin in the spinal cord and go on to the innervate muscles and glands throughout the body. Moreover, upper and lower motor neurons utilize different neurotransmitters to relay their signals, which is upper motor neurons use glutamate, meanwhile lower motor neurons use acetylcholine. Next, these two types of motor neuron has their own locations. Upper motor neurons are either located in the cerebral cortex of the brain or the brainstem. Lower motor neurons are located in the spinal cord and their terminals extend all the way to the muscles, fibers and tendons. This is the diagram of upper motor neuron and lower motor neuron. Upper motor neurons are first-order neurons which are responsible for carrying the electrical impulses that initiate and modulate movement. Various descending upper motor neuron tracts are responsible for the coordinate of movement. The lower motor neuron is responsible for transmitting the signal from the upper motor neuron to the affected muscle to perform a movement. There are three broad types of lower motor neurons: somatic motor neurons, special visceral efferent, which is the branchial, and the last one is general visceral motor neurons.
How can we detect that a person have motor neuron disease? The first one is muscle weakness. Gradual weakening of muscle is a common symptom. It often starts in one part of the body and spread over time. 2. Muscle atrophy. As the motor neuron degenerates, muscle may shrink due to the lack of nerve stimulation. 3. Spasticity. Some individuals may experience muscle stiffness and involuntary muscle contraction. 4. Difficulty speaking and swallowing. As the disease progresses, individuals may have difficulty speaking and swallowing, which is a dysphagia. 5. Difficulty breathing. In the later stage, respiratory muscle may be affected, leading to difficulty breathing. This is a significant concern in the disease like amyotrophic lateral sclerosis. 6. Muscle twitching. In the early stage, some people may notice muscle twitching or spasm. And the last one is fatigue. Generalized fatigue and weakness are common as the disease advances.
Assalamualaikum. My name is WAJIHAH binti Khairul and I'm going to explain about the death of football legend Mokhtar Dahari. Mokhtar Dahari was diagnosed with motor neuron disease (MND), a type of neurodegenerative disease which causes the gradual loss of motor neurons that coordinate muscle movement. In 1991, after battling the disease over 3 years, Dahari lost the battle. He was pronounced dead on July 11, 1991 at the Subanjaya Medical Centre in Malaysia. The cause of death was kept under wraps at the time. The press reported muscular dystrophy as the cause of his death. It was only after the release of a documentary called The Untold Truth about Supermoh. 19 years after his death, the world came to know about the real reason behind his passing. Next, I'm going to explain about cause of death about Mohta Dahari disease, which is neurodegenerative disease. Neurodegenerative disease are a group of disorders characterized by progressive damage to the structure and function of the nervous system. This often results in the gradual death of nerve cells, leading to a decline in cognitive or motor functions. Example, Alzheimer, Parkinson, and Huntington. Each disease has distinct features, common mechanism, involve protein misfolding, aggregation, and the formation of toxic substances that harm neuron.
Next is the neurodegenerative disease. Neurodegenerative disease can give us a lot various side effects to our brain, spinal cord, and also peripheral nervous system. This disease can give effect to some part of our brain. For instance, Parkinson disease. Parkinson disease affect to basal ganglia and also substantia nigra, which is caused by the level of dopamine. Other than that, Huntington disease. Huntington disease is also one of the neurodegenerative disease commonly, and it is affect to the only to the basal ganglia caused by the highly amount of proteins inside of it. Furthermore, neurodegenerative patients usually face brain shrinking, which is the size of their brain is smaller than usual. Moreover, neuronal death commonly occur due to the injuries to some part of the brain. When some part of the brain was injured, the unknown pathogens or microorganisms will enter and invade into the injured part of our brain and cause neuron killings and neuronal death, and also affect to our nervous system. Firstly is Parkinson disease. Parkinson disease is one of the most common neurodegenerative disease happens in our country. Parkinson disease is where the basal ganglia face problems. Basal ganglia consists dopamine, which is where dopamine is being transmitted from one neuron to another neuron at the junction or tiny gap called synapse. What is dopamine? Dopamine is one of the type of neurotransmitter that is function as to manipulate the body movement and our brain memory. The neurotransmitter called dopamine is produced by hypothalamus. The problems occurred when the dopamine inside the basal ganglia is less transmitted between the neurons. The side effect of less level of dopamine inside the basal ganglia is feeling tired, feeling unmotivated to do anything, and also feeling moody. It is very important for our brain to balance the level of dopamine inside our brain. Huntington disease is related to the increasing of proteins inside our brain. Protein inside our brain increases too much, higher than our sufficient amount of proteins needed. It can cause a lot of neuron killings and cause neuronal death. Inside our brain, there is a lot of blood vessel and blood capillaries. What is the function of blood capillaries, blood vessel? Its function to transport the substance from throughout whole of our body inside the brain. This is where proteins is being transferred to. When the level of protein is too much in our brain, it can cause dilation, and the dilation will lead to tumor, bleeding, and also inflammation to our brain.
To this day, there is no surgery in curing motor neuron disease or neurodegenerative disease. However, we can reduce worsening symptoms by treating this condition, which typically focus on managing symptoms, improving quality of life, and slowing down disease progression. Also, medication, physical therapy, assistive device, and supportive care are commonly used to address the symptoms and provide comfort to individuals with motor neuron disease. Keep in mind that medical research is continually evolving and ongoing to better understand the underlying cause of this disease. Hence, finding a cure is a complex challenge and takes time because motor neuron disease is an uncommon condition which is a very rare disease. That's all for us. Thank you.